Hey y'all, I'm Dr. Reagan, and welcome back to CRxOWN Talks, your dose of health and healing in Black communities. And in about 15 minutes or so, we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. And today we're talking about advocacy, advocating for ourselves. And a lot of times we kind of know what to do, but we don't really know how to do it or how best to do it. So today I am joined by Maria Jasanya. She is a nurse educator, a nurse midwife, a nurse writer, just all around nurse advocate for all things health. So we're welcome.
Thank you so much for having me here today.
Of course. So let's jump straight in and bust some myths. What's a myth about advocating for yourself in healthcare that you want people to kind of clear up?
Yeah, a lot with healthcare. So I've been a nurse since 2000. Well, I've been an RN since 2007. And what I noticed is that a lot of people, they just want to be considered the good patient. They don't want to
Mhm,
ruffle any feathers. And, it's important that we tell them that it's important for them to speak up for themselves.
mhm.
I always tell nurses that they are the patient advocate and they also should advocate for the patient as well as empowering the patients for them to advocate for themselves as well. So there's no such thing as the good patient. It's important that patients speak up, talk about their concerns with their healthcare team, the nurses, the doctors, physical therapists, social worker, whoever is part of that team, and letting us know what their concerns are. Because the more we know what their concerns are, the more that we can address them and that we can all create a plan together.
Yeah, I get that. Like, I get people think they don't want to be difficult or they don't want to ask too many questions or they don't want to do this and be considered labeled or whatever, a worrier or, a hypochondriac for whatever reason. Where do you think that idea kind of stems from?
Think because through people's experiences, they've probably had most times where their thoughts, their feelings were just dismissed by, unfortunately, healthcare workers who our responsibility is to learn from them. So they might think, oh, I've been having this pain for a long time, but maybe it's the way that I'm sleeping. Maybe I'm not doing this. And they try to rationalize it in their head and not bringing it up to their primary care provider. And sometimes by the time the pain is now evaluated, it was worse. It may have spread. They need physical therapy. They need different kind of medications because the pain was never addressed initially.
Yeah, that's really important that don't I hear a lot of times people say healthcare mistrust and medical mistrust, but really oftentimes it's the opposite. Like the system isn't trustworthy, right? And so
Yeah.
we have to, so as much as I talk to the community, I also talk to providers on this podcast to say you're the system. You have to make the system one that people can trust and feel comfortable to even advocate for themselves.
Yeah, I would say that, as nurses, we're usually rated as the number one trusted healthcare professionals. So we can definitely use that to our advantage to make sure that we're listening to the patients and addressing their concerns, as well as letting them know that they could and should advocate for themselves. So, we're here to listen to your concerns. The more we know what your process are, what you need, the more that we can advocate for you as well as help you here and when you get discharged.
Okay, so people say or they hear advocate for yourself, right? But what does that actually look like in a real patient encounter?
I would say that that begins with first speaking up to yourself. Us as healthcare professionals, we go through our training and we know that when we come into the room that we're supposed to wash our hands, we're supposed to have our ID up top at, close to our chest and should introduce ourselves to the patient. But let's say, for example, we don't. The patient should ask, hello, what is your name? What is your title? What service do you belong to? Because again, if someone's going to come there, ask you 101 questions about yourself, go and touch you, you should know who's touching you. You
Yeah.
should know who's asking you, confidential information. So that's what speaking up, I would say, eventually, initially begins. Also, too, when a provider goes in, we know that we're not supposed to use a lot of medical jargon, but
Mhm.
sometimes it's something that we're so comfortable with. So speaking up for yourself is when the provider comes to the room and starts speaking a lot of medical jargon, say, I'm sorry, doctor, nurse practitioner, nurse, I don't understand what you're saying. Can you please speak to me in layman's terms so that I can understand? That too is speaking up for yourself. If a doctor comes or, an advanced care provider comes and say, okay, we're going to do this, we're going to do this test, we're going to do this imaging, you should say, okay, what are the risks? What are the benefits? Are there alternatives to doing that? The provider shouldn't just be saying, we're going to do this, this, and that, but it should really be a collaborative joint effort between the provider as well as the patient. And that is something that comes, that's what advocacy looks like.
Yeah, it's because I know a lot of times it's just like what you said. The providers coming in, they're talking fast, or they have to, especially in an outpatient primary care type appointment. They got 15, 20 minutes, right? They got to move to the next room, so they're moving fast, talking fast, and not really asking a ton of questions or giving the patient a chance to ask a ton of questions. But so, what are some signs that the patient may say, this person isn't really hearing me or I'm not being taken seriously?
I would say if the provider is not stopping at different intervals while they're speaking and saying, or do you have any questions? Because a lot of the information that is coming at the patient is information that they're not used to. So if the provider is saying, okay, I explained this, do you have any questions? Then the patient should feel like, okay, they actually want to hear what my thoughts are. They want to hear, do I agree with the plan? They just don't want to, many times as healthcare providers, we think that, okay, the patient is shaking their head that they agree or that they understand, and that's also too a big misconception. Also too, the provider is saying, do you have any questions? You have listened to me explain this test, this procedure to you, but now do you have any questions? That too shall let the patient know that the provider is listening to them and want to really have this joint effort to them. Also too, the provider should be making eye contact with them, should try as much as possible to, be at eye level with them because, from back in the days, medical history is that medical, doctors were from like a patriarchal
Mhm.
mindset or a paternal mindset that they're the one that make the decision. But healthcare now, hopefully we're in the moving in the stage that it should be a collaborative effort.
Yeah, huge push towards shared decision making. So I'm glad you brought that up because that wasn't on my list of questions, but that's a great conversation. So tell us a little bit about what shared decision making is and what that looks like in an encounter.
Yeah, so what that looks like is that, the provider might be saying, an exam, a test, medication, and the patient should say, well, what are the risks? What are the benefits? Are they different ones? If maybe a patient is concerned about health insurance, as a lot of us are, is this covered by my health insurance? Is there a medication that is as effective, but perhaps is cheaper? Um, is there maybe a clinic or outpatient that is closer to my hospital, closer to where I live? If maybe let's say that they want to transfer them to like a rehab. Well, I don't want to go to the rehab all the way in the Bronx. My family lives in Brooklyn. I want them to be able to come and visit me as much as possible. And then, the provider might say, okay, let me get the caseworker involved or whoever involved to look for something else. And I'll share this very quick story. As you mentioned before, I'm a midwife. I had my baby over 2 years ago. And even when I was in the labor room, I was delivered by a midwife and everything was a collaborative effort. I mean, to the point where she sat and spoke to me and said, this is what I'm thinking about doing. Do you agree? And I said, oh, yes, I agree with that plan. Again, too, not only because I'm knowledgeable, but also because that's really how healthcare should be.
Yeah.
We should be having a discussion and making a plan together.
Yeah, because if I go see someone for myself or even for my child, my loved ones, I never tell them what I do because I want to see how they act toward. Because of course they're going to do it with me, right? Because they think you're a provider, but I want to see how you treat all your patients, right?
Yeah.
And so
Hmm.
that gives me a clear understanding of if you're really doing the right thing, or if I'm taking care of myself, because if I'm taking care of myself, I'm not paying you no copay. Okay.
Exactly.
But I do love the shared decision making, and I do a lot of what you're saying, right, with patients. I'm talking about, here are the options for a
Yeah.
certain treatment. Let me walk you through what these are, and then I let you make the decision. So you
Mhm.
have some buy-in into what we're talking about doing. And so I think that's super important in terms of advocating for yourself and and being more knowledgeable when to be able to make those decisions.
Yeah. I mean, that's the first step, that the patient has to have some kind of knowledge, because then how are you going to advocate for yourself not knowing anything? And of
Right.
course, we know that the internet is so full of information. So, really, it's about getting the accurate information to make a decision with the provider.
Yeah. So we hear a lot of news stories, a lot in the social media spaces about people feeling either dismissed in healthcare. We've seen the videos of you're a midwife, of the woman coming in pregnant and in
Mhm.
active labor, and the person is uh, doing paperwork instead of getting this patient to a room
Yeah.
to be in active labor. So what are some strategies that you can give our listeners about how to speak up in those instances, to kind of, even if they feel intimidated or overwhelmed, like what should they say and how
Mhm.
should they say it? Yeah.
Yeah, I think first is, of course, acknowledging the healthcare provider, but then acknowledging your expertise of yourself. Like in that instant, you can say, no, even if this was your first baby, like, I know my body, something is wrong. I know how I'm feeling. This baby is coming now. And really gathering like their urgency, like, this baby is coming now, or I have chest pain. I have a pain that it's 10 out of 10. I need someone's attention. Also, escalating. If you're speaking to one nurse or you're speaking to one provider and you feel like you're not being heard, ask, is there another provider that I can speak to? Is there a supervisor on the unit that I can speak to? To again, let them know what their urgency is for how you're feeling.
I think those are really great strategies, because oftentimes we don't really, sometimes it's like the fight, flight, or freeze method, right? And most people, no matter what they say, most people freeze because you're so shocked by what's happening. You're taking a minute to kind of process what is actually happening. So having those strategies and kind of words in advance, I think also for outpatient stuff like in primary care, go somewhere else. Like
Yeah.
you can always change providers, and I know it's a pain to look for a new provider, but if you're consistently being dismissed, yeah, it's time.
Yeah. That is a great point that you mentioned, that, I don't want to say you're not married to your provider, because even if you are married, that it is important to interview your provider to
Yeah.
see, like, does this provider have the same mindset that you are? Is this a provider that's holistic in thinking? That is not one that's just trying to push medication on you, but it's like, okay, let's look at your diet. Let's look at how you're exercising. Let's look at your stress. So really trying to find out about you holistically and how to manage what your conditions are.
Yeah, read reviews, you
Oh
know?
yeah.
Yeah. All right. Well, thank you for a great session. Before we head out of here, I do want to ask this. What should patients do before an appointment or before a visit, whatever, to better advocate for themselves?
I would say number one is kind of know who your provider is, right? So definitely do your reviews with them to have an idea. However you're feeling, that you should research it. And even if you are going to go on Google, which all of us frequently go on, especially now with the AI Google, you can look for things that will be cited from things that are like .gov, so that you know that it's a reputable source. .edu, things from like the CDC, things like that that you know are reputable resources. Read upon that. So you can say, oh, this pain that I have been having, I looked it up. It said that it might be caused like this. It said these are tests that might be done. So again, you're coming there and you're having some knowledge. And again, you don't have to mention everything that you research at first, but you'll let the providers, like, you'll explain yourself. You'll let the provider explain themselves. And you can say, this is what I read upon. This is what I saw. What are your thoughts? Do you think that this might be effective? So again, you're doing your research beforehand to come in prepared for the visit.
Look, you're gonna make the providers mad because they love to talk about Dr. Google, right? So you gonna make them mad. But I do, and you're an educator. I educate new nurses and nurse practitioners all the time, and that's AI is a part of our life, and we have to learn
Yeah.
how to respond to people coming in with and a lot of times, guys, y'all, you cannot trust everything you find on Google. You cannot trust everything you find on AI. But as these products get better and get
Uh-huh.
smarter, which they will, we have to be prepared in how to answer these people and know what's on the internet so that we can kind of combat some of the misinformation too that's out there.
Yeah, and then also too, what the providers can do is knowing that patients are going to come with information from Dr. Google is tell them, these are sites that you should look at to find
Yes.
evidence-based information because your patients are going to look at it anyway.
Yeah.
So instead of them being misinformed, give it to them. You can also, where I work, they have, Epic. You can put it in their My Wall. You can email them the website so that you can Epic chat them so that they have these things readily available. So they come into your visit beforehand knowledgeable, or even they weren't knowledgeable before. Now, when they go home, they can read upon these resources. So that's what maybe we can do better as healthcare professionals.
That's a perfect example of what we can be doing to make sure people are getting their information from reputable sites.
Yeah.
Well, thank you, Maria. Such a pleasure talking to you today.
Thank you so much for having me.
Yeah. And everybody, this has been your health check in with Crown Talks. If you love this, follow us on social media and share with anybody else that you think needs to hear it. Subscribe to us at Crown Talks, wherever you get your podcast medicine, and consider yourselves Black, healthy, and crowned. Bye bye.
Bye.